I'm Dr. Ray DePaulo, and I'm a psychiatrist at Johns Hopkins. I specialize in the treatment of patients with depression and bipolar disorder. And today I'm going to try to answer a question from a patient, a frustrated patient. And the question is, drugs don't work for me. Now what do I do? Okay. Well, first off, there are other treatments other than medications for depression, and we will talk about those. But first, I need to address the general statement that, quote, drugs don't work for me. It's a very natural feeling if you are a patient with depression, which is a horrible thing to go through, even when medications do work. And if you've tried 5 or 10 or even 15 medications that don't work, it is natural to, maybe in your own mind at least, generalize that drugs don't work for me. But we need to be very logical about this today. And so what I'm going to remind you is that there are about 50 medications that have been approved by the Food and Drug Administration for use in depression. And therefore, when we say that you've tried 5 or 10 or 15 medications that haven't worked for you, that really just means that we've tried 5, 10, or 15 medications that don't work for you. Now, the other thing about a medication is that as a practicing psychiatrist, I want to know how do we know that medication doesn't work for you? And the two main criteria to find out if the medication might work for you. And one is, did you take a dose that would regularly beat a placebo, or what I prefer to call a sugar pill? And secondly, did you take it for long enough to know that it'll work? Well, how long is that? And the answer is that it really takes 8 weeks on a medication, an antidepressant, to be confident that it's not going to work, okay? And so now, obviously, sometimes patients will stop medications before that time because they have intolerable side effects. And the caveat there is that are the side effects not tolerable because they are frightening or because they are literally dangerous for your health? And it can be very hard without a lot of supervision by a physician to know the answer to that one. Very few patients, in fact, have taken 50 antidepressant medications each for 2 months. That's 100 months. That's a long time to demonstrate that each of them won't work. Now, there are other treatments, I said earlier, and those other treatments include, for very severe forms of depression, ECT or electroconvulsive therapy, TMS or transcranial magnetic stimulation, and VNS, vagal nerve stimulation. Okay, and each of these involve both risks and benefits. The risks are lower with TMS, but the benefits are probably somewhat lower as well. And it's also a bit more quite costly and can take a long time. There are other treatments that are experimental that involve brain stimulation, but those are not far enough along yet to recommend them for care. The other thing we should talk about, obviously, here is what about psychological treatments, including things that are mostly psychological, even things like acupuncture, various forms of meditation, yoga, okay, and some things that people wouldn't consider as medications, but they are in fact, and that is the natural supplements. And St. John's wort was maybe the most famous of the ones that was tried there. And what I can tell you is, putting aside the supplements, that the psychological treatments and psychotherapy of many sorts, such as CBT or cognitive behavioral therapy, or IPT, interpersonal therapy, and various other forms of therapy, all can be very helpful in patients with depression, but they work best along with medications if you've got a severe depression. I'd like to close on a quote from Thomas Edison when he invented the light bulb and explained how he got there. Another person, a woman as I understand it, said to him, "Gee, you failed 10,000 times before you succeeded." And he replied that he didn't fail 10,000 times. He discovered 10,000 things that didn't work before he discovered the thing that did work. remember that. That's what if you need medications, there are, for almost everyone, we don't want to generalize. There's a way to find 10,000 things that don't work and then find one or two that do. We hope, obviously, that we'll get the one or two before we failed 10,000 times, but we never give up. So hang in there. There's lots to do.